I'm Julia. So for acquired aplastic anemia, there are two main kinds of treatment, evidence-based and non-evidence-based. The first evidence-based treatment is a bone marrow transplant. It's also called a hematopoietic stem cell transplant or an allogeneic stem cell transplantation. It replaces damaged stem cells in the bone marrow with healthy stem cells from donated blood or bone marrow. It is the recommended treatment for children and young adults. In it, an affected individual's abnormal bone marrow cells are destroyed by chemotherapy and replaced with healthy marrow from a donor, which is transplanted by injecting the donor's cells intravenously into the patient's body, where it travels to the patient's bone marrow and begins producing new blood cells. The best match for a transplant is an identical twin sibling or close relative. Potential problems include graft rejection or graft versus host disease, which can be mild to life-threatening and can be prevented or treated with drugs. The second evidence-based treatment is medical therapy, which is also known as pharmacotherapy and includes medications to treat aplastic anemia. For some patients, bone marrow transplants may not be an option, and therapy with drugs that suppress the immune system may be used instead. This can be immunosuppressive agents, hematopoietic growth factors, anti-metabolite or purine anti-neoplastic agents, and iron chelating agents. Since acquired aplastic anemia is thought to result from an individual's immune system mistakenly attacking bone marrow, suppressing the activity of the immune system also allows the bone marrow to recover and begin producing new blood cells. Two of the most commonly used immunosuppressive drugs are anti-thymocyte globulin, or ATG, and cyclosporine. Horse ATG has been found to be more effective than rabbit ATG. This is the recommended treatment for older adults or those without a suitable donor, and restores blood count to normal or near normal levels. Potential problems include that it is not permanent and must be repeated, or the possibility of refractory aplastic anemia, in which for approximately 1/3 of patients, treatment is ineffective. The third evidence-based treatment is blood transfusion, which delivers new blood, including red blood cells and platelets, and quickly stabilizes those with severe blood cell deficiencies. Potential problems include that it does not achieve long-term recovery. It can create hemochromatosis or iron overload, which damages vital organs, and patients can develop antibodies to transfuse blood cells, making treatment less effective. The fourth evidence-based treatment is supportive care, which includes a central venous catheter, which is a tube that carries medicine to a vein in the chest and is helpful for those who require frequent transfusions or infused medications. Infused blood products for those with deficiencies in certain blood elements, platelet infusions to prevent spontaneous bleeding, and people with aplastic anemia have a weakened immune system and are more susceptible to infections, whether from bacteria, viruses, or fungi, so antibiotics or antiviral or antifungal drugs are also used. Non-evidence-based treatments for aplastic anemia are those that are not founded in proven scientific evidence. These include Chinese herbal medicines, also known as traditional Chinese medicine, which have been found to be effective, safe, less toxic, and have fewer side effects in bone marrow failure-related diseases, although the long-term effects on aplastic anemia patients remain to be seen. Adaptogenic herbs have been found to be effective, those such as astragalus, panax ginseng, and romania, and adaptogenic herbs help the body respond to physiological stressors like anxiety and fatigue that may accompany a diagnosis of aplastic anemia. In aplastic anemia, prevention of other infections is key, so recommended herbal remedies are meant to help boost the immune system, such as vitamin C and D, probiotics, elderberry, and echinacea. And antioxidants, such as glutathione and plant compounds called flavonoids, have also been found to be effective, as frequent blood transfusions can cause iron overload, which can lead to inflammation and organ damage, so drinking tea and eating fruits and vegetables can reduce the amount of iron absorbed from the digestive tract and reduce the iron load on the body. The second non-evidence-based treatment is lifestyle modifications. Aplastic anemia can cause fatigue and exercise intolerance, so rest and low-intensity exercise can help preserve energy levels, and avoiding high-contact sports decreases the risk of injury and uncontrolled bleeding. The third non-evidence-based treatment is nutrition. A plant-based, nutrient-dense diet with a variety of fruits and vegetables, whole grains, and legumes, or the neutropenic diet for those with low levels of neutrophils. The neutropenic diet requires that adherents cook all vegetables and fruit before eating or buy them canned, avoid raw or rare cooked meat, fish, and eggs, avoid deli counter foods, consume pasteurized dairy products, and wash their hands and cooking surfaces before handling food.